Good morning, everyone.
Hi, Chris.
Hey, Michael, how are you?
We're good. How are you?
Good.
Michael.
Okay. I can't hear anything of it. 1 second, it has to be made louder. How do you make it louder?
Participer.
Wait a second. Wait. Okay. How do you hear?
So I muted some of our lines while people get in and get acclimated and get comfortable.
Can you hear me? Can you
I
see
can.
me?
How are you?
Hoi. Hi.
Good to see you, Orna.
Hello from Rotterdam.
Hi, Orna.
Hi.
Rotterdam. Hello.
Yes. Hello. And where are you from?
San Diego.
Okay. It's
Hi.
so nice. Hello. I see Avi.
Avi!
I see Avi. Is it Avi I know?
Yeah, I think so.
Yes, we believe so.
Avi, thank you for joining. This is Adele.
Oh, it's a pleasure.
Hi, Avi.
Hi.
So we meet here if we can meet physically.
Well, we spoke yesterday. It's strange. Strange
Oh.
thing to say. What?
Everything is gone. I have no video
Oh, no?
anymore.
We
What
can
is
see.
happening?
We can see you.
But everything is gone. What is happening here?
Oh no, we can hear you.
I don't see anything. Just out. What's going on here? Oh, okay, now you're back. I see. Can you see me?
We can see you, Orna. Yeah.
Oh, okay.
We can hear you.
Yeah, it's coming back now. I have video again. Yes.
Ah, Avi, we haven't got it on.
Hello.
Let's put it on.
Hello.
Hello.
But why do I see only one person at the same time? Not more. Oh, I see.
No, she's seen your name, I think, possibly, Avi.
I see now Avi and Ruti.
Orna, you can see me?
We can see
Now
you,
I
Orna.
see you, Yvonne. Is it Yvonne?
Yeah.
I see you half. I see half of your face. Yes. Yeah. Yes.
That is better?
That's better. Yes. Yeah.
That's the first time I joined, so.
Oh, okay.
Everyone.
But why do I see only one person at the same time?
Orna, if you look in the upper right-hand corner of your screen,
Yes.
you may see a button that says Gallery View. Hit that button.
Oh yeah. Yes. Yes. Okay.
Click that button.
Yeah.
Hey.
Yes. Now I see more people. Nice.
Oh my God.
Michael.
I actually see we have another special guest in the room today. I see my mom there.
I know. I see Mary.
Mom, how you doing?
Hi, Mary.
Mom had a birthday this week. Mom, happy birthday.
Happy birthday.
Happy birthday.
Happy birthday. Happy birthday.
All those
Birthday.
gray hairs on Mom's head is my fault. It was me.
Leave that.
Mary, Mom, why don't you wave and let everybody know who you are? Oh, there's more people I have to admit. Hold on.
Oh. Hi, Marianne.
All sorts of people. Oh my gosh. I had a bunch of people backed up in the waiting room I had neglected.
Hi there.
Good morning.
Let's take this down. Do you want to take that off, Avi? This
Oh,
side?
great.
Ruti, you look real.
Me?
Yes, and you too, Abby too. Yeah, you both. You look just
Unbelievable.
real. As if
Yeah, you look
we're
just like...
having a coffee on the water in Amsterdam.
Let's do that again. Let's do that again. We do that every year.
Oh, I'm going to cry.
No. Please.
Oh,
Unbelievable.
yes. Oh.
Done this before.
Chris, we should have people put in parentheses where they're zooming in from. It'd be
I
kind
know,
of
right? Right. If people can, you can change your name. You can put what country you're from too. So there we go. Hey,
Okay.
Charmaine. Charmaine's sitting outside today. Look at that.
Yeah, I just got back from my walk and I'm kind of a mess, but you know, it's all about exercise, right? So,
It's new times. I mean, even at work, we're all showing up, from outside walks, and there's cats in front of the screen.
yeah,
It's a whole
I
new
might
world.
be batting away the super mosquitoes if I stay outside.
We had 41 yesterday, 41 degrees this week.
Christina, we see you there from Oakland. How are you? Oh, hold on, you're mute. Hold on. Oh, there we go. Yeah, you're unmuted now. Nope.
Fantastic. Hey, everyone.
Hey.
Calling in from
Hi.
Oakland, California.
Dr. Veerapong, hi, good to see you.
how's it going? I have to look down like this, like Brady Bunch. You're on the lower corner of my screen, so.
Well, why don't we go ahead? I've still got people joining. I'll keep letting people into the room, but we might as well go ahead and get started. So first of all, thank you everybody for coming. We are so excited to see everybody. This is the highlight of all of our weeks, at PMP Pals, just to be able to see your smiling faces and offer any insight and advice and give you a chance to share advice with one another too. So thank you so much for coming. We'll do quick introductions. So I'm Chris Piekarski. I'm the president of PMP Pals. And I'm a 16-year survivor of PMP. And we will go ahead. We have a few special ambassador guests today who are joining. Brendan, I'll let you introduce yourself to the group.
Hey guys, my name's Brendan. Thank you guys for having me this morning. Excited to be on with you all. I live in Los Angeles, California, and I'm an ambassador with PMP. I don't know if it was probably 2 years ago. I think I met Chris online and he invited me and he actually taught me everything about PMP. I had never heard about it and everything that you guys go through. So I flew into Monterey and I spent an evening with you guys at one of your annual conventions. And it was amazing. And I've been in touch with Chris ever since, and he leverages me and I leverage him. And I'm just on here to encourage you guys to continue to work out and train and stay on your daily routines as you guys get back to recovery and as you guys continue to stay healthy. So I'm going to encourage you guys a little bit to just keep on moving, using your bodies, using your minds, and keep moving forward in a positive direction today.
Brendan, we're so excited you're here. And I am intentionally wearing my Orange Theory Fitness top today. Both Adele and I have been doing Orange Theory Fitness for years. And I mean, it's a fantastic workout. We really enjoy it. I mean, it's so much fun, and we're excited they'll be starting back up again soon in all the different regions where that's being done safely. But for me, it's a key part of staying healthy and staying fit. So Brendan also is one of the business developers. Brendan, your franchise is in Los Angeles, I believe. I know there was this, I became aware because your San Jose Willow Glen studio was right behind my house. So
yeah, personally, my studios, we have Australia, we have Cincinnati, Ohio, we have Los Angeles, the Bay Area, East Bay Area, but the company is worldwide. We're in 30 countries worldwide.
It's amazing. It's amazing. It's like the Starbucks of workouts. I can go anywhere in the country when I travel on business, and I can always visit a studio and get the same workout, and I can text with all my friends and laugh about how much pain I'm in after the workout. So true story. Well, Brendan, thank you for being here, and we'll give you a chance to talk more about some tips in a minute if you feel so motivated to do that. I also wanted to introduce Dr. Jula Veerapong from the UCSD Cancer Center, Moore's Cancer Center. Dr. Veerapong, thanks for taking the time to be here today.
Of course, my pleasure. Just to give you a little background about myself, I'm a surgical oncologist here in San Diego. I've actually been here at the UC San Diego for, I guess, since August of 2017. So almost just about 3 years now. you know, a little background about me. I had a passion for cytoreductive surgery and HIPEC. Prior to coming, I was in St. Louis for about 5.5 years, where I had started a program that kind of encompassed several states, including Missouri, Illinois, Kentucky, Arkansas. And so a lot of you guys know Andy Lowy, who's the head of the program here. He recruited me over here to be part of the team, along with Dr. Joel Baumgartner and Dr. Caitlin Kelly. So I'm happy to be here.
So Dr. Veerapong, actually, I mean, all of our specialists are amazing people. Dr. Veerapong took the time to put together a few slides. So after we had a chance to chat for a little bit, we'll take a look at those slides, and we appreciate that. But welcome, thanks for being here. I'll go around the horn and try and give everyone a chance to introduce themselves. If you want to give your name and what city you're in, and whether you're a patient or caregiver, you're welcome to do that, but don't feel like you need to do that. You're welcome to remain anonymous, but we'd love to meet you and just chat with you. So Adele, would you like to go ahead and introduce yourself?
Sure. Adele Jason here, Vice President of PMP PALS. I'm in Toledo, Ohio. I'm an 8.5-year survivor, and I am proudly wearing an OTF t-shirt too. As Chris mentioned, I'm very excited pre-pandemic. That was a key part of my regular routine. And I echo all of Chris's comments in terms of being thrilled of everybody that's participating this morning.
That's great. James, I see you up there. Would you like to introduce yourself?
Yes, good afternoon, it is here. James Caldwell from Northern Ireland. This week, 6 years ago, I had surgery for a high-grade mucinous adenocarcinoma of the appendix, and I'm doing reasonably good, thank you.
Congratulations on your anniversary, James. That's awesome.
Thank you.
That's great. And James is also one of the administrators in the PMP Appendix Cancer Facebook group. If you're not a member of that group, I'd encourage you to go there. If you are looking for information or support from other patients and caregivers, it's a great place to ask questions and get tips. So James, thanks for your work there. Thanks for being here today. Michael, how are you?
Hi guys, Michael Healy on the south coast of Ireland in the afternoon as well, obviously. I'm an 8-year survivor, a patient of Basingstoke in the UK, currently doing well, and a bit of a fitness or exercise fanatic, let's say. It's my counselling, my go-to peaceful place. So most days I get exercise, so I'm a big fan.
That's great. Michael, thanks for being here. Michael is also one of the administrators in the PMP Appendix Cancer Facebook group. And I think we all recognize him for his constant encouraging and hopeful messages that he puts on that Facebook group. So yeah, thanks for being here. And then Charmaine, I see you down there. It's hard to keep track. There's so many faces today.
Hi, I'm Charmaine Skillman. I'm in Austin, Texas. I'm on the board for PMP PALS and was diagnosed 22 years ago, doing fine now.
Thanks for being here, Charmaine. Gosh, I can't even keep track. I'm not even sure how to do this anymore. Connie, why don't you say hello real fast? So Connie's a volunteer at large who's helped us at conferences before. Oh, hold on, Connie. You're muted. You see if I can unmute you.
Mute. That was me. It was on my end. Sorry about that. I'm Connie. I live in West Fort Lauderdale, Florida, caregiver, and my husband is a 5-year survivor with cancer.
Thanks for being here, Connie. Connie's husband, we've made posts in the past about Captain Chemo. So Connie's husband likes to get dressed up in different outfits, and they are so off the hook, unbelievably funny. And so he has all his nurses laughing, and so that's part of how he stays mentally healthy. And we always love seeing those pictures. And we appreciate your volunteer work at our conferences that we go to, Connie. So appreciate you.
You're welcome.
Yeah, you
Thank
bet.
you.
Yeah. So I'm just going to go around the horn. Christina, if you want to say hello from Oakland.
Hey, hey everyone. I'm so happy to be here. It's my first time on the call. I was diagnosed in 2009 and had a surgery, stem to sternum every year through 2013. And I'm so happy to say that I'm doing well. I believe in exercise and movement as medicine. And that was my theory before getting diagnosed. And then I went through the gauntlet and realized how true that is. And, you know, if you can't move your body, then move your breath, you know? So I'm just really happy to be here and to help support in any way I can.
Thanks for being here. And I can tell you, you know, I thought to call Christina and invite her because we all start to see each other on Facebook, and Christina is constantly exercising. So she's the Energizer Bunny. So she's got good advice if you're looking for workouts. And as she said, right, she's managed a lot of physical challenges too in the midst of all that. So we're glad to see you thriving for sure.
Thank you.
Thanks for being here. Orna, do you want to say hi to everybody?
Hi. Yeah. I don't know what to say more.
Tell us where you're from, because people have joined.
Yeah, okay. I live in Rotterdam, but I say always when I speak about especially the PMP, I mentioned also Israel, because I'm originally from Israel and I had there my life-saving surgery in 2008, and I'm still here. And I'm also a very big believer of movement, and this is my healing miracle movement.
Thanks for being here. Thanks for being here, Orna. Mom, you want to say hi to everybody? My mom's here today. Can you hear us, Mom? There she is.
There she is.
Where are you, Mom?
Hi, I'm Mom, and I live in South Carolina. The whole family's here on the East Coast. Christopher escaped, and so we still hope we'll get him back someday. I was his caregiver when he had his surgery, and I could tell a lot of funny stories, but that would embarrass your president. So,
Mom, I so expect you to say something inappropriate at this moment.
It's my talent.
It is. It is. So, even though I lived in San Jose, California, I went to MD Anderson, I went to NIH, I saw Paul Sugar-Baker at Washington Hospital Center, but I ultimately selected Armando Sardi, who was at St. Agnes at the time. Today he's at Baltimore Mercy. And I grew up in Baltimore, and so my folks were there. Mom was a caregiver, and that was my journey. So we often have to do that.
His brother was supposed to be his caregiver, but his brother wouldn't stop making him laugh, and it hurt too bad to laugh.
We just talked about that earlier this morning. Yep, for sure. Thanks for being here, Mom. It's good to see you. Mary Ann, it's good to see you again. How are you?
I'm good. I'm good. I'm Mary Ann, and I live in Northern Virginia in a little town called Haymarket. I had my first surgery about 3 years ago at Hopkins, and then I had a second surgery last summer about a year ago at Hopkins again. So that's sort of my story.
Thanks for being here. It's good to see you every week. You look great. Thanks for coming. Yvonne, I see you next on the screen.
Hello.
Hi.
Hi. This is Avi Berkovich from Israel. I was diagnosed and had my operation 4 years ago. And I'm very glad to join you today, first time.
And it was the same surgeon as Orna's surgeon.
Very good. And what surgeon was that?
Professor Nissan. Could you hear?
Yes, we can hear.
What surgeon was it?
Professor Nissan.
Avi, also Avi.
Professor Aviram Nissan from Israel, from Sheba Hospital.
It was wonderful.
Charmaine had the pleasure of meeting him and doing a focus on the physician article on Dr. Nissim. So, Charmaine, do you want to talk about that memory? He's a great guy.
Yeah, we were going to talk for about 45 minutes, and I think whoops, I might have lost my connection.
We can see you, Charmaine.
Oh, okay. Well, anyway, he was great. He was very generous with his time, and I learned a lot of interesting things about some of his practice in Israel. It was really great.
Yeah, that's awesome. Well, that's great. Congratulations to you guys. He's a great surgical oncologist, no doubt.
Yes.
And then Yvonne, I see you there.
Hello.
Hello.
Hello. I am Yvonne, and I live in the Netherlands, in the south of the Netherlands. And I had my first HIPAC in 2005. And then after 12.5 years, it came back. And my second HIPAC I had in 2017 in December. And after 2.5 years, I have a reoccurrence. So I'm now on wait and watch. And I don't want chemo, but I want to live as healthy as possible. We will see on my next MRI scan in June what I'm going to do.
That's great.
That I feel good, in fact.
You look great. Watch and wait can be really tough, mentally,
Yeah.
but it's often the right thing to do. So that's good. Good for you.
Yeah, because I have a LAM, they call LAMN, and then the normal chemo will not work, I think.
Yeah.
So a third HIPAC would be an option.
Yep.
We'll see.
Good. Well,
Thank
we're
you.
hopeful for you.
Yes, thank you.
Good. So we've made it through. Hey, Cheryl, you want to say hi to everybody?
Hi, everyone. I'm Cheryl. I'm calling in from North Dakota. I was diagnosed last June or July. I was initially ineligible for surgery, but through chemo, I was able to go through surgery in January. So I'm coming up on 4 months post-surgery. And I know, we're talking about exercise today. I was never a big exerciser. I was a kid in high school that would sneak a cigarette during gym class. Thankfully, in my 40s, I smartened up, started to exercise a lot, and I credit that for my recovery. And, in the past few years, I've taken up scuba diving, so I'm looking forward to getting back to diving. And that's my story. So
That's
doing
great.
well 4 months post.
That's great. It's never too late to start exercising. I mean,
No.
it's just, and I think the funny thing is once you start doing it, you realize it gives you energy. It doesn't take it away. It's not like I'm taking away from my,
Yeah.
My amount of energy for the day. I get more energy on the days when I take the time to work out.
Yeah. Who knew? I wish I knew that as a teenager.
I know, right? Good. So, Anne from Ocala, I see you there. Would you like to say hello?
She doesn't have audio, obviously.
You may have to mute her or.
Florida. I was diagnosed February 3rd of this year. I'm sorry?
There we go. You're unmuted
Can you hear me?
now. And now your
Can you hear
signal's
me?
back in. How are you, Anne?
I'm good. From Ocala, Florida, diagnosed February 3rd of this year, had a right hemicolectomy March 4th of this year, and so far so good. Nothing found in the lymph nodes or the colon.
Good. Now, are you seeing a specialist, Anne?
I am not. No, I was initially diagnosed with colon cancer, and they told me it was the same thing. So it was specified as appendix. It said appendix on the pathology report. They told me colon. But there's no specialist in Ocala. So, I mean, I'm not sure really where to go. So I'm not, again, it's the conveniency when you have a child and jobs and, how easy it is to get to certain places. And so my next scan is in September. I'm really not sure, if I'll stay in Ocala or what to do. I'm not sure really where to go with this yet.
That's great. Now, you've been in contact with Connie, I believe. I think you guys might have traded emails or something like that.
We need to do that.
Yeah. Oh, I think I sent it through chat last week.
Okay.
Did you receive it, or do I need to?
No, I
send it
did
again?
not.
Okay,
But Chris
I'll send it
can,
again.
Chris can text you my phone number, and we'll go from there. But I did look up some things for you in your surrounding areas, so I'd like to share that with you.
Okay, perfect. I appreciate it. Thank you.
You're welcome.
And you can send an email to zoom@pmppals.net. If you just shoot an email there, then I'll make sure I make that connection then.
Is Tampa a reasonable travel distance from you?
I apologize. I have UF 45 minutes from me. That's a teaching hospital.
Oh, in Gainesville?
Yes. I'm really in Central Florida, but like I said, you know, I have a 12-year-old. I have 2 positions. I'm a full-time teacher and I'm a speech pathologist. So, I mean, I'm pretty much going back to my regular routine, but in the back of my mind, I'm just kind of going, I don't know what's going on because my appendix did perforate.
Yeah.
So, I was just kind of gonna wait till September and go, okay, here's my CAT scan. Where do I go from here? I don't know, because they said they didn't see anything, so I figured that was good news.
I don't know anyone in Gainesville, but I do know people at Moffitt and Miami. So we can certainly talk offline. I know I can certainly try to find someone who is at the University of Florida, Gainesville. I know surgeons out there, but not HIPEC.
I don't know if I would need HIPEC because they haven't found anything. So anyway, I'll take it offline.
No worries. It's good to see you again, Ann. We'll get you in contact with Connie. And, you know, there's a lot of decisions to be made on this journey. We're lucky that this cancer in relative terms can move slowly. So yeah, I mean, we'll offer as much or as little advice as you want, but we're glad you're here for sure.
Thank you so much.
Yeah, you bet. And then Rita, we see you again. How are you? You want to say hi, Rita? You're unmuted.
Hi, Rita. Hi, this is Rita. I'm being treated at Sloan. Dr. Andrea Sirsik is my oncologist. And my first surgery was done by Dr. Diem. My cancer is back again, and I'm waiting to get my CA levels stable because I had coronavirus, so my CA went high. Once it's stable, I'm going to go for another surgery with Dr. Nash, hopefully soon.
That's great. You're one of our centers of excellence. Dr. Nash is a brilliant man. And so glad to see you here again. We're hoping the best for you.
Thank you.
It's great. Hi, Joanne. How are you?
Good. How are you? This is my first time on.
Great to have you here. Thanks for coming.
Yeah.
Yeah.
I got a crazy story. I am a Dutch Canadian. I see there's been a few Dutch people on here.
Yeah.
I am an athlete. I'm 58 years old, have 4 daughters. We are a kiteboarding family. And I ruptured my appendix March 13th in St. Lucia doing a really big jump. Walked around with it for 3 weeks. They couldn't believe I survived, and I credit that to Orange Theory. I have been at Orange Theory 3 times a week for 3 years, and they said that's the only reason I survived.
That's awesome. That's a great story.
So yeah, listen to this. So 6 weeks I was cleared. My husband said, wow, you survived. We took the girls to Hawaii. Pain started all over again. I started kiteboarding. They said, Mom, you're pulling a hernia. There's 4 of us in the medical, okay? So anyways, came back. Long story short, they said, it's your appendix. I said, you guys took it out 3 months ago. They said, well, we don't know what to tell you, but we missed it on the first go. So I had my second appendix out. And 2 weeks later, they called me and it was stage 4 signet ring.
Yeah.
So I had my HIPEC 3 weeks ago. I'm doing extremely well. They sent me home after 10 days, which they've never seen. And they said it's because I'm so fit and I do so much activity.
Amazing.
So,
I do this all the time and I'm getting chills right now. That's an amazing story. That's fantastic.
Pretty crazy. And even through chemo, they could not believe my levels bounced back. After 4th or 5th day, I would go back to Orange Theory and work out, and they're at the gym. They're like, you're nuts. But it's the only thing that kept me going.
Dude, that's awesome. That was great. That's amazing. That's amazing. Thank you for being here and sharing that story. We appreciate it. That's great.
Yeah, thanks for the PMP support. I see Michael, I recognize him from Facebook. I'm just kind of learning the lay of the land because I haven't been on there very long.
Yeah, well, you're doing great. So do you mind me asking who your specialist was, who did the HIPAC?
It's Judith McCart at Mount Sinai in Toronto.
Okay, great. That's terrific. Well, welcome. Thanks for being here, and thanks for sharing your inspirational story. That's great. Let's see who I've missed. Hi, Sharon, how are you? Oh, you're mute. Hold on, let me unmute you.
It takes a bit to be able to get there. Hi, I'm Sharon. I'm from Bendigo in Victoria in Australia. So it's now, is it 1:30 in the morning, Sunday morning here. I had my HIPEC back in December 2016. I had, they thought it was lamb and then it ended up with deep ham features and what have you, but I'm fairly clear since then and doing well. Yeah.
That's great. That's great. It's good to see you. Thanks for being here.
No, thank you.
You bet. Cindy, you want to say hi?
Hi, and this is actually, can you hear me?
I can.
Okay. And my name's actually Mandy Elliott. My laptop shut down on me twice while I was trying to join on time. So I grabbed my mom. So this is Mandy. I had my first HIPAC 2014, second one 2016, and then 2018 they did just like a 5-6 inch incision and removed a tumor off my bladder. That was appendix cancer that had grown back there. And then that year I also had low-grade breast cancer, so it was like taking turns, one surgery then the other, and then radiation. And my first tumor was like real close to my spine. So I have some nerve damage now from that I feel in my legs and everything. And sometimes when I try to do anything working out, like watching a video or something at home and try and do anything that involves my midsection, 2-3 days later, I'm usually like at a 7 or 8 on the pain even sometimes. So I saw that you guys were doing this and I was like, that's great. I can get some ideas and maybe something better that I can do to try and get a little stronger again.
That's great. You're a veteran. And I always hate when I hear of patients having a fight. I was going to ask about this. Nicole, I'm still rolling. That's awesome.
I had to wear my to one of my follow-up appointments, and then for my second HIPAC, I got a T-shirt with the operation guy's face on it, and it says, "You removed my what?" So that pretty much works because they took out everything they could. So
that's great. That's great. Well, thank you for being here. Sounds like you are working through the process. You know, Dr. Jula Veerapong from UCSD is here. I'm not sure if you heard the introduction, but he might have some ideas for alternate exercises. But I mean, each of us, I mean, the joke goes, we all become swimmers in the end because our knees can't take running. You know, we move on to less impact like cycling. But so I think we all struggle with that. But I think as patients, you know, we often have different complications as well. I did oxaliplatin, so I've got neuropathy from the elbows down, from the knees down. And so, you know, these are challenges we learn to navigate. But yeah, so, well, good. Hopefully we'll have some good advice for you. Thank you so much for being here. I love your shirt.
thank you.
You bet. Jen S. from Perrysburg, do you want to say hello? It's muted right now. I'm trying to unmute on my end. You might have to unmute on your end. I see you clapping there.
Yeah, so Jen's probably okay.
Okay. Thanks for being here, Jen. We appreciate you. We hope we share some information. And then I think I've got everyone, but last but not least, Mike, I was waiting on purpose. I saw you there. I knew that was you, man. Mike Weber has a foundation in New Jersey. He's one of the donors at large for PMP PALS. And I have the pleasure of going out there and playing golf with him. And Dr. Shardy shows up sometimes as well. So how you doing, man? Good to see you.
Hey, Chris, great to see you. And
good morning, good afternoon, good evening to everyone around the world. It's incredible the reach that PMP Pals, just to see it firsthand here and the impact that it's had across the globe. Like Chris said, I run a charity called the Mike Weber Senior Memorial Foundation in memory of my father, Mike Weber. And I'm actually just gotten off the course practicing my golf game for hopefully when I see you in the September there, Chris. But I just want to say to everyone, I'm here just as such an admirer of the incredible strength, that you all in this tight-knit community continue to support. And, hearing the stories from so many of you and the challenges you've been through and the smiles you keep on your face, that's what motivates me to try and contribute in any way I can to your prosperity moving forward. So, thanks so much for having me, Chris. I'm just fortunate to be a part of this and, praying and rooting for everyone in this tight-knit community and, looking forward to working closer with everyone moving forward here.
Mike, thanks for being here. I mean, Mike has an amazing family, an amazing community. The golf tournament's one of my favorites every year. So, yes, I look forward to seeing you in September, man. Look, I think part of health and exercise and safety during our current situation around the globe includes sheltering in place and staying safe and using masks and, making sure that we're using our PMP Pals antibacterial hand cleanser. But I'll make that trip if we're all getting out, Mike, for sure.
Looking forward to it, Chris. And, thanks again for having me here. It's a privilege to be here with you guys. Thanks so much.
You bet. So unless I've missed anyone, have I gotten everyone? Let me ask. And I'll take silence as we've all been introduced. I'm going to turn it over to Brendan for just a couple minutes here. And Brendan, I'd love to hear more about your transition from being a Super Bowl champion to a business developer for Orange Theory Fitness, and how does exercise play into your routine and your mental health? And I'll tell you, I mean, I've known Brendan for a few years now. He's not only physically fit, but he is mentally sharp as a tack. So a guy with great business acumen and always inspirational stories. So thanks for being here. I'm looking forward to hearing what you have to say.
Wow, how do I follow it up with everything that you guys have been through, whether you're a caregiver or you've been a patient? I think what I realized in just these last few minutes from hearing about you guys is that there's something special that connects us all. And I've lived in Amsterdam and I played football there. I played football in Canada. I lived in Fort Lauderdale, and I'm just, figuring out my connections to all of you guys, and it's pretty remarkable. But I would say that just from hearing each and every one of you guys have an essence for life, you guys have some grit, you have a passion about you, and you guys are all fighters. And that just gives me goosebumps just to hear all your stories. So keep on keeping on, keep doing what you're doing, because you guys are survivors, you guys are inspirational. And I'm around a lot of different people in the health and fitness industry every single day, besides the last few months, but on a normal basis. And you guys are definitely very, very inspiring. I would say that fitness kind of found me. I didn't find fitness. I just always had a passion to move and to, I did diving when I was a little kid. I did gymnastics, I was swimming. And then of course I played all the sports that you would think a jock would play: baseball, basketball, football, track, wrestling. So I lettered in 5 sports in high school. I just love to move my body. Whatever it takes to move my body, I'm going to do it. And I think that that's why I'm so healthy. And I think a lot of you guys that have bounced back from this, and a lot of you guys that are surviving and thriving, that there is some component to fitness. But what is fitness? Don't get fitness confused with going to the gym. Fitness is dancing. Fitness is going for a walk. Fitness is moving your body. Basically, it's moving. And if any of you guys have any ailments, there's a bike called an Airdyne bike. It also has another name. People call it the assault bike. And it's a bike that's not just your legs, but it's your arms as well. So say your knee is bad one day, you can rest one leg, you can ride it it's a stationary bike, you can ride it with one leg in your arms. Say both your knees don't feel good, you can ride it with both arms. Say one of your arms doesn't feel good, you can ride it with both legs and one arm. So it gives you so many different options. It's a bike that you can put in your house, you can wheel it in and out of your garage. It doesn't need to be plugged in or anything. It has a battery. You can just turn it on and you can ride the bike. Obviously, people don't like to be indoors all the time, you can go on walks. You can have a pet. Pets are really good for your health as well. Obviously you have to take care of the pet, and the pet's going to take care of you, and it's going to give you a lot of love. But I love walking my dog, and I track my miles walking my 3 dogs. But there's a lot of different things you can do with fitness. And even if you need to just sit down and just do arm circles, or like Orna's doing right now, she's just rocking back and forth. I mean, obviously when you go through a surgery, you just have to start moving. And in fact, when I had a knee surgery, because I played in the NFL, like Chris was saying, I played 13 years of professional football. I had a knee surgery. I came out of the surgery and I had a machine that was moving me. So it's just kind of one of those things. If you don't use it, you lose it. And when it comes to aging, you don't get old and stop doing things. You stop doing things and you get old. So if you keep doing things, you're not going to get old. You're not going to age. So keep doing all those things. My mother-in-law wants me to put an elevator in the house. And I said, heck no, I'm not putting an elevator in my house. You need to walk up those darn stairs. So, yeah, so I'm a huge fitness enthusiast, and I think fitness comes in so many different shapes and forms and fashions. And there's so many benefits beyond just, hey, fitness. The fitness world isn't, hey, I want to look good. It's, I want to feel good. I want to prevent cancer. I want to slow down my aging process. I want to have a greater bandwidth mentally. There's so many different aspects to fitness. It's not just go to the gym and lift weights, or there's so many different avenues. And I heard you guys talking about kite surfing and outdoor sports or golfing. All these different things get you out. And I think it's great to have a fitness community around you. So having people that you do like-minded types of fitness things with, like if you have a dance partner, people dance forever, right? And they're in amazing shape. So whatever the modality is that you choose, have somebody that goes along with that journey with you. And you guys are going to help save each other's lives. Even someone who thinks they're perfectly healthy and fit, if they're not working out, then there's something missing there. So you guys can grab people and pull them along with you, or hopefully you can have somebody pull you along, and you guys can lean on each other on tough days. And that's what the fitness community is about. So yeah, you guys are inspirational, motivational. And so thank you for having me on. I love when Chris gave me a call like last minute. I'm like, oh, absolutely, I'll come on, and super excited to be here. So yeah, thank you for having me. Thanks for listening to me. But more importantly, you guys are filling up my cup more than I'm filling up your cup. So thank you.
Thanks for being here, man. We always appreciate having you here. And yeah, obviously Orange Theory's been a key element of a number of our health and success here. So thanks for being here. And
yeah,
you know,
funny because we're in Israel too. So I heard you guys talking about Orange Theory. We're in Haifa, and sure we'll be in Tel Aviv eventually, but it's a company we're trying to deliver fitness to everybody. People wear heart rate monitors, so we want to gauge. We don't want to work you too hard, but we don't want to underwork you as well. There's kind of like a sweet zone in fitness. If you can get out of breath, so you don't want to have a conversation, but you're able to work in that range, that's kind of when a lot of special things physiologically happen with the body. It's just when you're a little bit out of breath. So if you're going on a walk and you can just pick up the tempo and then bring it back down and pick up the tempo, or whatever it is you're doing, just try to get a little bit breathy, and you'll see that the benefits to your fitness will increase.
That's great. Perfect tip. Yes, Orna.
What's the name of the company? I forgot.
Orange
Theory Fitness.
Can you say it again? Sorry.
Orange Theory Fitness. I'll type it.
You know, orange, isn't that a special color in the Netherlands? I mean,
it's a special color.
Yeah. I couldn't understand. Yeah.
Okay.
Orange, oranje, yeah.
Chat, put it on the chat for everybody.
I did.
Yes, please. Thank you very much.
Yeah, but like sometimes people get intimidated to go into fitness places. Orange Theory also has an online program that's free. And you can just go to YouTube, and they'll come up, they have exercises every single day, and you can use things that are in your house. So say they want you to do something like they want you to do shoulder raises, or they want you to do squats. They can tell you, say, hey, grab a couple cans of beans or a couple cans of corn, and we'll use these cans or water bottles as well. So they also have home programming that you guys can jump into. You don't even have to leave your house. But there's so much fitness out there. You don't even have to leave your house to get really amazing fitness. Just Google, research online, whatever modalities you think you're interested in or things you want to do. There's home dancing. There's different programs you can do on bikes. I have a Peloton at my house as well. There's a lot of different things you guys can do. I love yoga. So just get your bodies moving and going and get to feeling good again.
I've got my milk jugs filled with water, as you know, after one of the videos suggested that, Brendan. Same thing from an OTF video. So there's lots you can find around your house. Well, good. Well, thanks for being here, man. It's good to see you again. We appreciate it.
My pleasure.
And I think I'm going to move along. Unless there's any other questions that we have, I'll open it for a second.
I was interested in seeing Dr. Veerapong's slides, if this is a good time for that.
That's a perfect segue, Charmaine.
Prepared?
Yes.
Brendan's a hard act to follow, though, so this is kind of like boring stuff.
Well, you have all the good information right here.
Well, and Dr. Veerapong, as you start, I want to say, I called Dr. Veerapong because, you know, sometimes in the past and in the Facebook groups, I've heard things like, we shouldn't do sit-ups before HIPEC because it might distribute tumor. And, you know, I've always been a believer in exercise. And, you know, I hired a trainer before my HIPEC and while I was doing chemotherapy, and it was integral to my mental health and feeling prepared and feeling like I had something I could do that was actively helping my health. So I did that. But again, I've heard these statements, and I called Dr. Veerapong to confirm that that's not really something we should worry about because the benefits of the exercise are so much greater. So I'm not going to steal his thunder. I'm looking forward to seeing the slides too, but I thought it was worthwhile to mention that as you start, Dr. Veerapong.
Oh, absolutely. Absolutely. And we can certainly, you know, I'll show you some of my slides and then we can talk about all of that, kind of dispel the rumors and the myths. You know, I wanted to introduce a couple key concepts that has kind of taken you know, surgery by storm more recently. It's the whole idea of, you know, you guys all know PMP, you guys are part of the group, but the whole concept of enhanced recovery after surgery and this concept of prehabilitation. You guys can all see my slides?
We can.
Mm-hmm.
Okay. Mm-hmm. So the whole idea of enhanced recovery after surgery, or commonly we call it ERAS, some people will call it ERAS, is it started out almost 20 years ago, really, from a Danish surgeon who basically said, why is my patient still in the hospital? And this was during a time where a patient would go in for colon surgery, and it's just removing, it's not the kind of surgery you guys all went through where you guys are having multiple organs removed. This is just removing one part of the colon, but patients were in the hospital for a week or a week and a half. And he said, why are patients in the hospital? And so he understood that, you know, it's not about doing one intervention, but kind of doing a bunch of interventions as a whole. And all he did really was do some education, do early feeding, and then a key component of this is exercise, early mobilization, called this fast track surgery, and he got people out of the hospital in 2 days. He wrote this up and people didn't believe him. But it has since evolved to this really complex scheme of a multimodal, multidisciplinary means by which to take care of patients, utilizing evidence in the literature. And it starts from a pre-admission phase to a preoperative phase. So a pre-admission phase would be, you know, the weeks to months leading up to surgery. The preoperative phase is like the days leading up to surgery. And then the intraoperative phase, and then the postoperative phase. You guys don't have much control over the intraoperative phase. It's mainly the surgeon and the anesthesiologist. But you do have control over nutrition and exercise pre-op and post-op as well. You can see that early mobilization is one of the key components. And this approach leads to decreased complications and allows patients going through these major surgeries to leave the hospital sooner. So enhanced recovery, you can see from the previous slide that it's so crazy. It's so many components. Nutrition, medical optimization, like stopping smoking, stopping drinking, carbohydrate loading. None of these in and of itself really is something that would affect your recovery. So it's kind of the sum of the parts, rather. It's kind of almost like, you know, when you enter, if you take a look at this F1 pit crew, You know, you got the guy in the front left tire, you got the guy in the front right tire, you got the guy who's, you know, jacking up the car, you got the guy who's like putting in the gas, putting in the fuel. But rest assured, if you miss any one of those components, this Ferrari is not going to run. And this pit crew gets this car out in like 1.9 seconds. And that's the whole idea of enhanced recovery after surgery. And we actually have our version of enhanced recovery after surgery. You can kind of see this is a sample patient pathway that we give, you know, at the time of diagnosis. And everything in red is basically associated with physical activity or exercise. You can see that we have recommendations for cardio exercise and strength training. And you know what? You have to tailor this to your needs. Some of you are going through chemotherapy and you can't do that much exercise before surgery. Some of you are not going through chemotherapy and are having surgery in 2 weeks. So you don't have that time frame of 2 to 4 weeks to prepare. You can see that post-op day, as soon as you get out of the operating room, you're in a chair, you're walking from your post-op days 1, 2, 3, and all the way until you're discharged. And then even post-operatively, you know, we want you to be active. Walk as much as you can. Some of you guys like to weight train, and you can't do that anymore because, you know, it takes about 2 months for your incision to heal, and you don't want to develop a hernia. So we say, you know, don't lift anything greater than 10 to 15 pounds, but we want you to be active and walk as much as possible. I kind of want to introduce the concept of prehabilitation. And Chris, we talked about this just the other day. So you can see that the solid curve is what a person who goes through surgery kind of without any kind of pre-op exercise or pre-op nutrition or pre-op stress management goes through. You have a certain capacity, and then when you have that 12-hour surgery and you're in a hospital for weeks, your functional capacity decreases to a functional threshold. And it slowly ramps up as you're starting to rehabilitate and then as you're starting to get your ability to exercise. But the whole idea of a prehabilitation is to exercise and bring that functional capacity up. So once you take that hit of the HIPEC surgery, you're able to recover faster. And so a good analogy is you guys all know Meb, who's a fantastic athlete, won the Boston Marathon. And what does he do to train for the Boston Marathon? He doesn't just walk in cold. He does long runs, tempo runs, speed training, cross work, core work, altitude training. But when he was asked, what is the biggest non-training component to his or non-exercise component to his training? It's nutrition. And cytoreductive surgery and HIPEC, as you guys all know, it's like a marathon. Diagnosis, first of all, may take months because you guys are 1 in a million. You guys may have gone through 5 different doctors before you reach the right person who made the right diagnosis. You guys may have had other diagnoses like cirrhosis, and they think that you're a heavy drinker because you have fluid in your abdomen. Or you have appendix tumors, but you originally went to a gynecologist because they thought you had ovarian cancer. And then if you have high-grade disease, you may undergo chemotherapy. And then you may even undergo many procedures like removal of your colon or laparoscopic surgery before you even reach the stage of being diagnosed for HIPEC. And then once you get to that point, the surgery can be 12 hours long. You know, some people have had 16, 20-hour surgery. You're in the ICU for several days, sometimes a week. You're in a hospital for several weeks. And then on top of that, once you get out, it takes, because you have an incision that's going from your breastbone to your pubic bone, from stem to stern, as one of our members said, it can take up to 2 months for your incision to heal. And then after your incision heals, it may even take 3 to 6 months before you start feeling normal, start eating normal, or back to a level where you're feeling comfortable before surgery. And then a lot of you, as you've mentioned, have repeat surgery. Once you're done in a year or two, then you're back at it again. So enhanced recovery is kind of like training for a marathon. We even offer carbohydrate loading. The whole idea is that we give carbohydrate loading the day before surgery and then immediately before surgery. And you guys have all gone through this where you've had a bowel prep, you're pooping all night, you're tired. They tell you can't eat anything or drink anything after midnight. Well, we try to give carbohydrate loading the night before surgery and up to several hours before surgery so that you can have a reduction in that thirst, hunger, and anxiety. And as part of an enhanced recovery program, pre-op carbohydrate loading actually can potentially decrease hospital stay and infections. And then getting back to the idea of prehabilitation, most of the work in terms of prehabilitation has been born out of McGill University, and it's a trimodal. It's a three-part program where exercise is one component, nutrition is another component, and anxiety and stress management is another component. As Brandon said, this is as much mental as physical. And in terms of outcomes, patients did better at 1 and 2 months. Patients had greater postoperative activity. Twice as many patients who did this kind of prehabilitation program were able to be back to a baseline walking capacity. So in summary, enhanced recovery is very complex. Exercise is a major component. Diet is very important. And I think if you had to remember one thing about these slides is that exercise and prehabilitation may actually lead to faster recovery. And this is a great graphic to take a look at.
Dr. Veerapong, I love how you summarize that with that one picture. One picture is worth 1,000 words, and it's a great one.
And this is a picture of Brandon. He was kind enough to take a picture because I told him I was a Bears fan. And this was at Monterey. And there's that must be the Super Bowl ring kind of in the corner there.
Yeah.
That's awesome.
And of course, after this, if you guys have any questions, I put my cell phone number and email as well. But questions, I hope that wasn't too didactic or boring.
Not at all, no, perfect. Anyone have questions for Dr. Veerapong? Cindy, I know your situation comes to mind.
Yeah, I don't have any specific questions I can think of right now. There's so many little things that go into how my body works differently now. Obviously, you saw no colon, the nerves in my legs, my midsection, especially around where the tubes were going down my ribs, can get very sore very easily. So trying to do something that doesn't inflame everything so easily is kind of the key to me anymore, because I won't take a pain pill unless I am starting to get teary-eyed. I don't like them. I've been on too much of it when I was in the hospital, so I just try to avoid that as much as possible. I do muscle relaxers and things that I end up taking once in a while, but usually they give me a bottle of 20 for the year. Like, that's how often I take them. So trying to get more active but not be in pain is the key.
Well, I kind of like what Brendan was saying earlier is, the whole idea of keep moving, because when you have an incision that goes from stem to stern, your whole core is just out of whack. Normally you have your abdominal muscles balancing your back muscles. And then in your case, when you had surgery that was, Cindy, that was kind of probably involving the psoas muscle, which is a muscle that helps you do sit-ups, there's a nerve that goes over there, and that probably had to be sacrificed to some extent. And so you're not able to, either you have numbness on the side of your leg, or you're not able to bend or kick out your legs as easily. So
I actually thought I was having a problem with my hip.
Right.
But then when they realized it's in the front, not really deep in your hip, that they realized it was more of a nerve issue.
So that's something where you can potentially incorporate the upper body as well.
Yeah.
Or even swimming, like you said, Chris.
Yeah. I do like swimming, and I wrote down the bikes that Brendan told us about so that I can look some information up on those as well.
I put them in the chat, so there, if you look at the chat feed, the names of the bikes are down there.
Awesome, thank you.
Oh, that's awesome. Yeah.
Sorry, can I just ask Dr. Veerapong? I had the enhanced recovery.
Yes.
After my surgery. I just had a hemicolectomy for high-grade disease, but there was absolutely no way I could tolerate food or fluids immediately post-operatively. In fact, for about a week, I couldn't eat or drink anything. Is that not a common problem?
Did you have laparoscopic surgery or open surgery?
Open surgery.
Okay. It's very common. You know, anytime you do open surgery and you touch the bowels, they hibernate. And you guys all know that. You guys probably took about a week, a lot of you took about a week before you could even eat anything or have a bowel movement. And then when you add heat and chemo on top of that, that kind of exacerbates things. But yes, it is very common. And the whole idea of enhanced recovery is to try to, you know, minimize that. But yes, and people, what you have was probably called an ileus, where your bowels were hibernating. And it just takes a while, and people's bodies are all different, even if you're part of the enhanced recovery program. Who knows, maybe without the program, it'd take a week and a half to recover.
Yeah, well, I mean, I was home in 5 days, so I was happy with that.
Yeah. Excellent.
Thank you.
That's good.
I had a question.
Go ahead, Cheryl.
I was interested you showed the drink, or about carb loading.
Yes.
What are your thoughts on protein shakes? Pre-surgery, I started to drink the stuff called Impact.
Yes.
That I'd have to chug.
Yes.
After surgery, I couldn't even drink it. So I started to get on there. I need my protein. What are your thoughts about protein shakes? Should we be having like Impact, one of these high protein shakes pre-surgery, even just as part of your regular diet? What are your thoughts on protein shakes?
Yeah, I think what you're talking about is immunonutrition, the Nestle Impact.
Mm-hmm.
And there's not a lot of data about it, you know, just having it just, you know, outside the realm of surgery.
Okay.
But there is data for it, and it has to be arginine based, and it has to have omega-3 fatty acids, so it tastes like fish, doesn't it?
Yeah.
It's not good tasting. I've tasted it. The data in the literature is that if you take preoperative nutrition, and it has to contain arginine and omega-3 fatty acids. I put this here. I don't even understand biochemistry, so I put that there just kind of as a reference. But the data says that if you have it 5 days before surgery, up to 3 times a day, so basically you have 15 of these that you're taking, that there may be a decrease in wound infections, a shorter hospital length of stay, and fewer complications. It is extremely hard to do it after surgery, and all the data is designed more for patients who've had, you know, maybe just one surgery, like part of their colon, but not necessary like when you have your spleen and your gallbladder and your right colon and your rectum and your uterus and your ovaries and all your whole lining removed. So, but we're trying to incorporate this in our program, but it's understandably, it's very difficult.
Okay, thank you.
That's great. Well, I will point out we are just at the top of the hour. Feel free to stay if you'd like, or if you need to move on to your day, that is okay too. Don't feel like you have to stay. But I'll offer that up. You can, if you need to get out and go exercise, feel free to do it. I'm going to challenge each of us to go outside and get our exercise today. So don't worry, that will be a challenge. Christina, I was going to ask you to speak about some of the exercises you do, because I see you running, and when we talked last night, you had just finished along running the hills.
Yeah, so thank you. I have always been playing sports since I was big enough to kick a ball. So it's kind of in my makeup. And it was integral in my healing process. from the point of, as Dr. Veerapong was just saying, you know, taking measures before the surgery to not just get out there and exercise, but to get that connection going to my core, because I knew that it was going to have that full fillet. And I wanted to try to reinforce my mind-body connection as much as possible before the surgery, and try to have that imprinted. Now, whether there's scientific proof to that, I don't know, but I can tell you that it did make a difference coming out of the surgery to re-engage with my core and with my breath. And after the surgeries, you know, we're in the tubes and we can't move. And I thought, well, what can I do? And I did isometrics straight out of the gate when I was in my hospital bed, and did breath work. I had done a lot of yoga prior to the surgeries. So there was already the practice of different kinds of ways to move the breath through to try to get that invigoration going again. And so as soon as I could, as Dr. Veerapong was saying, I got up out of the bed and was doing laps around the unit, you know, with the gown flowing, and I would just do a check mark on my little whiteboard in my hospital room for each lap that I did. And every day I tried to do one lap more. And, you know, trying to get the bowel moving again too after surgery is so frustrating and really, really challenging. And what I found was that the more that I moved my breath and moved my body, the better my bowels worked. And it was hard and it was uncomfortable to move some days. And, but I just dug deep and found that that mechanical, you know, getting the diaphragm to work again. And so my diaphragm had been pretty much lasered away, and my transverse colon had actually perforated through my diaphragm and into the pleural cavity. Oh, wow. So trying to get that breath working again was such a challenge. And what was that?
That's my husband commenting on, there you go. Same issue.
So just reconnecting to the breath, trying to get that to work, was, you know, I found that walking helped. And then when I could run again, I started running, and that's my passion is running and dancing. I dance samba as well. And what I found was that actually it was a great combination, because the running got my diaphragm moving. And I think that there was something to that, the mechanics of the diaphragm, that actually helped the peristalsis. So even to this day, I find that if I don't get moving, if I don't get running, my gut slows a little bit. And I think that even though I'm 10 years out, or 11 years out, actually, it's still, exercise still matters just as much as it did right after the surgeries. And the piece with the dancing is really interesting. I found that my left side, I had a very hard time to connect to it after the surgeries. And so the running is very linear for the most part. And what I found was that the coordination of the dancing, you know, you're in these 360-degree forms of movement, and you're trying to have this organization of your body and how you move it in dancing was a great way to reconnect to my core. And I'm totally rambling, sorry about this, but it's just, there was such a great complement of the running and the dancing. But a lot of it is, you know, it really has just become a prayer in motion for me. Every time I'm out on the trails, you know, I'll just go run forever. And it's such a celebration of this body that, you know, I thought was never going to resurrect. So I don't know, it all starts with the breath, and then you just go from there. And some days you can, and some days you can't, but you just see what you can do. And, you know, it comes down for me to gratitude for this body that, that made it through. So, so that's kind of the seed of my movement, is just deep gratitude.
That's great. You know, you reminded me, I think all of us have had this experience when we are recovering, that we have the thought of, I would do anything to not be in this bed, in this room right now. And so I'd encourage us all to connect to that feeling that we had then and celebrate the fact that we can get up and can get out today. And with that thought, I'm going to challenge everybody to get out and get some exercise and connect with your breathing. And if running is not going to be the right thing for you today, move your arms, go for a walk. If even laying in bed, you can do some isometrics to exercise. I'd encourage you to do that because it's going to give you more energy than you believe. And you're going to feel good.
Can I make a quick comment?
Absolutely.
I don't know if you guys use Fitbits or Apple Watches, but they gamify exercise. So for me, I want to burn 800 calories a day, aside from my metabolic rate. So metabolically, if I just stayed in bed, I'm going to burn somewhere around 3,000 calories, but I want to get 800 active calories every single day. So I wear my Apple Watch and it tracks my calories. It tracks how long I stand. Yes, while you're standing, you're burning more calories than while you're sitting. And maybe some people have to start with just standing or, like I mentioned, arm circles, but it's a great way to set some goals and then to chip away at those goals on a daily basis. So they know that psychologically they're going to pull you in by you having this little device, and this little device actually keeps you accountable. So find these little tricks, try to hack the system, if you will, and find ways to just do a little bit more, to move a little bit more every day, or to be a little bit more active. I wish I could do Samba like Christina, but she's right. You're moving on different planes of motion, and your body's not just supposed to go straight forward. So try to incorporate twisting and turning and bending and all these things that your body was built to do. And there's people that are perfectly healthy and they're not talking about exercise, and you guys are recovering, or you guys are going in and we're talking about exercise. So that's so inspiring that there's people with these perfect bodies and they're not using them. And everybody would do anything to have a perfectly healthy body, but these are some things that you can do and take advantage of your bodies. Even though you guys are fighting through PMP, there's still a lot that you can do. So don't forget that.
That's awesome. Thank you.
You know, one thing that I wanted to mention is I recently signed up for a new set of emails. You know, there's a lot of sources for encouraging emails of the day, etc. And I saw a reference to one that was by a college coach, and I can't remember his name, but one concept that he mentioned is this idea of 1%. And things can seem so overwhelming at times, but each day try to do just 1% better than you did the day before. And that just seems so small that I think, of course, I can do 1% better. And in the days when I don't feel like doing anything more and really am backsliding, I try to really hold on to that idea of 1% more, whether it's just 5 arm circles or leg lifts or, you know, maybe an extra block on my walk with the dog. And, you know, pretty soon you're going to reach larger goals just by very small incremental changes. And I think it's really inspirational to hear from people like Christina and, of course, Brendan. You know, I look at you guys as super athletes, and Dr. Veerapong, I know from conversations with you too, you're really committed to exercise personally as well. And, you know, you guys are really inspirational to me, but I know at this age and with my physical condition, I can't do as much anymore, but I can always do 1% better. So I think finding whatever it is that inspires you and helps you really do better than you did yesterday, that to me is a win, regardless of how small the incremental improvement is. That's a win in my book.
To dovetail on that, Charmaine, you know, I think you bring up such a great point about the 1%. And with that, you know, exercise doesn't have to be this big event. It can be little bits throughout the day. It can be, you know, a push-up off your kitchen counter, you know, just little bits here and there. And those touch points will help to connect, again, that mind-body connection. It'll help that regenerate throughout the day. And that might even be better than trying to do one big effort. You know, have those dots that you can connect as the day goes on. So there's many different ways. And I think it's just about finding the way that works for each of us. So
I like the way you talk about the mind-body connection. Chris, maybe we should do something about that. It just got me thinking that, I just pulled up this app called, if you guys ever heard of Buddhify. It's basically guided meditation. And if you recall, part of prehabilitation is anxiety and stress reduction. And one simple way is just meditating, even if it's just listening to your breath, for 5 minutes in a calm room. Do that a couple times a week, and I think you may, have a noticeable difference in your sense of well-being.
It's part of what I do every day. I start with 5 or 10 minutes of meditation just to, recenter, and we can scare ourselves for sure just with the thoughts about the day, and when we take a moment just to recenter and see how we're really feeling with meditation, it makes a huge difference in how you start your day and how you move forward through it.
I grew up as a Buddhist, and we would go to temple and we would be in this like half lotus position, and we'd do this and we'd be like this for half an hour, and it's kind of, actually, to be honest, it's kind of painful. And so so meditation can take different forms. It could just be turning off the radio on the way to work and just for 5 minutes just avoiding the brain chatter and listening to your breath, or just at your office, sitting at your chair and just kind of, just breathing for 10 minutes and just listening to the surroundings and centering your breath.
It's awesome. It's great. It's great.
Chris, just a comment?
Yes, of course, Michael.
I suppose I'm certainly not a supreme athlete or anything like that, but it all started for me in the hospital bed when I was high on morphine. And I promised my 2 adult kids that we would do a 6.6 mile run a year after surgery. And of course, I got the thumbs up from both of them. So then I came home and they said, well, are you going to start preparing for, 11 months' time when we're doing the 6.6K run? So I was kind of forced into it, but I just found I've done 6 of those in a row with my family. The same month, it happens to be on the same month each year, obviously. So I just found it's, it's kind of a marker each year. It's a goal, I suppose, not just for me, but for the extended family as well, to see that, if you can do a 6.6K run, you can be pretty confident your health is reasonably okay. And I suppose just to show, it was cancelled this year because of COVID. So I just found it a big gap in the year, in the calendar, in the frame of mind, with nothing to replace it. But I just think you can't beat having something like that once a year at least, to aim for.
I would go back every September. Dr. Sardi had a walk, and it's become huge. Hundreds of people. It's gotten really big. Dr. Veerapong, we might have to do that for UCSD. To see patients together. Once we get past the current situation with the coronavirus, but that might be a goal for the future.
Great idea. All of you guys from Israel, Australia, Canada, Netherlands. We'll invite Brendan. Brendan can be our marshal.
Right. Absolutely. I see. I'm having a vision of jerseys that say PMP Pals and Orange Theory Fitness all over them. The ideas are just popping.
When are we doing the International PMP Pals convention? That's what we got to do.
Right.
Hey.
Yeah.
There you go.
Good.
And Michael, my family's from my mom's family's from Ireland.
What part?
Give me a second. I'll remember the city.
No problem.
Let me just rack my brain real quick.
They're all just questions.
I'll tell you later.
Well, good.
Her name's Rita. My mom's name's Rita.
Yeah. Okay.
Well, with that, I think I'm going to suggest we conclude the day and get the day started, conclude our program. But man, it is truly the highlight of my week doing this now. The question, as we get ready for it, it's how many people are we going to have this time? And I don't know, and I don't care anymore. because it's my inspiration for the week. So thank you for being here and being the best part of PMP Pals. And if you have any questions, if there's anyone's story that you want to connect with on a deeper level, send an email to zoom@pmppals.net, and we'll be happy to help facilitate that connection. But thanks for being here, Brendan, Dr. Veerapong, all of you individually, and make it a great week.
Chris, one final thing.
Yes.
I would just say that if anybody is doing any exercise of any description, please put it on the support page. You never know who you inspire along the way. Might be somebody just home from hospital and you're doing a short walk of a couple of 100 meters. That may be all they want to hear or want to see, so.
I love it.
We all inspire somebody else, so put them up there.
Absolutely. We'll look for emails of pictures in Zoom. Yes or no?
Yeah.
Would it be possible to get the slides
yes.
by the mail? I'm
Yes.
very interested to read it again.
Yes.
Yes.
I can send it to you, Chris, and maybe you can, if you have a list, you can send it out to the group.
Yeah, you have my email
We do.
address. Yeah, thank you very much.
You bet. Yeah, so send that over to Dr. Veerapong and we'll email it out.
Cheers.
Great.
Thank you.
Thanks,
Bye.
guys. Have a great day. Send pictures of your exercise today. I want to see the pictures.
Brandon,
Take
I want
care,
to show you one thing if you stay on.
Okay.
Thank you.
Yeah, bye,
Michael,
everybody.
I dropped you a message. Michael, I told you the city in the chat. It's Meath.
Super. Thank you.
Take care, everybody.